I'm going to talk both about stress urinary incontinence and the overactive bladder, which is a sudden need and urge to go to the toilet. So I'll just go through that a little bit first, then we'll talk about some of the treatments. I just wanted to say that the majority of people here are women, but a lot of you will have partners who also have problems with urinary incontinence. And as I said before, about 1 in 3 women have problems with urinary incontinence, but it's about 1 in 10 to 15 men also have a problem. And I think probably men are even worse than women coming forward to seek help for their problem. And as we mentioned, it's not just the older age groups. A lot of people think that it's just older women having problems, but lots of women in their 20s and 30s who've had children, to their dismay, find when they try to go back to the gym and get themselves in shape that they have problems with leaking, and that leads to avoidance, depression, a loss of sort of self-esteem. I'm sure a lot of people in the audience will have a super range of black trousers that they wear, and your life just gets a little bit smaller. Now over here I met Yvonne, who has got a beautiful pair of pants that you can wear with a built-in pad support for going to the gym. So if you're worried about your pad leaking when you're doing the star jumps, go and talk to Yvonne, because I thought that was a super innovation. So stress incontinence, it's the involuntary loss of urine during activities such as coughing, sneezing, lifting the children, jumping on the trampoline, walking down the stairs. Hopefully nobody is doing this sort of weightlifting activity, but it just serves as a little reminder, if you are going to the gym, be a little bit careful about the weights that you're lifting or pushing, because lifting or pushing heavy weights in the gym can actually cause damage to the pelvic floor muscles and worsen problems with urinary incontinence and with prolapse. So why do women get stress incontinence? A lot of it is based from initial damage caused around the time of giving birth. There's a little ligament that supports underneath the urethra. The urethra is the little tube here that you pass urine from, and this represents a ligament that can get damaged that allows the bladder, the urethra, to move during activity, and that combined with damage to the pelvic floor muscles here can result in urinary incontinence. There's a few other reasons as well, but that's the general problem: a weakness of muscle, a damage to tissue that results in poor closure and easy leakage from the bladder. It's very important to know where your pelvic floor muscles are, because they're an often neglected thing. And there are, I'm sure your Continence Foundation has some pelvic floor exercises that you can do, and certainly if you go to our Ayuga website, which I'll give you at the end, there's some good teaching tips on how to do effective pelvic floor exercises. So just to mention, we're talking about urinary incontinence today, but going along with urinary incontinence, we also find that it's very common to have problems with prolapse. Now, prolapse means a weakness or a dropping of one or more aspects of the vagina. So in this case, we've got a weakness in the back wall of the vagina, resulting in the bowel falling forwards, and that can cause problems with being able to empty your bowel, apart from being very uncomfortable. This is the bladder falling forwards, and then you can get the uterus coming down as well. So we often find that we get these problems along with the urinary incontinence itself, and we can fix all of these at the same time. So it makes me quite sad in my job that I see a lot of women who come to me having suffered sometimes for many years. And I was talking earlier about a lady who actually spent so much money on her pads that she didn't have electricity for several days of the week. She went without food, she was unable to get her job. She was really, really desperate by the time she came to see me, and I don't want that to happen to anybody ever again, so I'm really quite passionate about putting forward the idea that urinary incontinence is common, but it's very treatable. I get a lot of excuses. I was too embarrassed to talk to my doctor. Never be embarrassed to talk to your doctor. They're perfectly well aware of this and very comfortable to talk to about it. A lot of people don't realise that anything can be done. They don't talk to their friends or their family. They keep it to themselves because they feel ashamed. You shouldn't be ashamed. It's a medical condition like anything else. And some people have tried physiotherapy, which helps about 3/4 of women, but If the physiotherapy isn't working, then you probably need to go forward to have a surgical treatment. And this is one of the very common and very widely used treatments that we do. Thousands, millions of women worldwide have had this thing called a TVT, or a retropubic sling. I said it takes 15 minutes to fix a leak. It actually takes me on average about 12 minutes. So you think 12 minutes of my time and 12 minutes of your time, usually done as a day-stay procedure, and you can go from being wet and with a confined life to being dry and just getting on with things. This may look a bit scary, but let me orientate you. So this is the pubic bone that sits at the front. This is the bladder sitting behind, and this is the urethra where you pass urine from. And this little tape is very simply put in with two little tiny weeny cuts about ½ a centimetre long just above the pubic bone, and about a 1 centimetre long cut in the vagina. And we basically just thread a little tape up behind the pubic bone to take the place of the ligament that's been damaged, and it's a very effective and very, very straightforward treatment. There's a couple of other forms of this that you might have heard of. One is called a transobturator sling. It's the same principle, but it just runs in a slightly different position. And there's also one called a mini sling, which doesn't involve the little cuts either in the thigh or above the pubic bone. These have all got around about an 85 to 90% chance of making you dry, not just now, but in many years to come as well. When these little tapes go into the body, your body then grows into them and locks them in place. It stops them moving, and you get an immediate result. So the day you have surgery, you're basically fixed. If you're worried about taking time off work, usually 2 or 3 days off work, and you can go back as long as you're not doing heavy lifting. It's usually about 2 to 3 weeks of avoiding any heavy gym work and lifting, and then you can just carry on with your life as if nothing had ever happened. So just a little word on male stress incontinence. The commonest forms are due to things like prostate surgery or radiotherapy for prostate treatment. Some of it will be age-related, and as I say, the majority of men don't seek help. Now, treatment for this, I'm a gynecologist, not a urologist, so my knowledge is more limited, but there is the equivalent of a female sling for a male, for men, and there's a much more complicated procedure that involves part of the continence mechanism is a little ring of muscle called the urethral sphincter. If your urethral sphincter is damaged, then this is an artificial version of that, and that can be damaged during prostate surgery. And of course there's also physiotherapy, and there's pads for men as well as pads for women that are available. The other very common form of incontinence is urinary urge incontinence, and that's the involuntary loss of urine after an overwhelming urge to go, and you just can't stop yourself. And that's really common. I'm just getting up to my front door, I've got bags of shopping in my hand, I put the key in the front door, and oh God, I've got to drop my bags and dash through the front door to the toilet, leaking along the way. And with the normal bladder, as your bladder fills up, it fills up in a very relaxed way. It gives you a little bit of a clue that you might need to go to the toilet, but you say, well, actually, I've just got to finish peeling the potatoes and I'll go in 5 minutes, thank you very much. With an overactive bladder, that's OAB for short, with an overactive bladder, the bladder decides that it's going to squeeze and push the urine out, even though it's inconvenient for you at a time that you don't want to go. This unfortunately isn't easily treated with 12 minutes of surgery. It takes a little bit more work, both from us and in combination with the physiotherapies, and if necessary using some medication. But before we get to that, we always like to ask you, what medications are you on? Could you be on some medications that are making things worse? And if you do suddenly find that you start on a treatment and you get that urgency to go back to your doctor and see if it's a side effect of one of the medications. We know that things like caffeinated drinks can irritate the bladder, so by decreasing your coffee intake or your tea intake, or taking a decaffeinated alternative or water, that's going to help. One of my bugbears is bottled water. Apart from the fact it's probably full of plastics and estrogens and whatever else, I get an awful lot of people in who drink litres and litres of water. I do live in a hotter climate, but you really only need to drink about 1.5 to 2 litres of fluid per day. You don't need to drink more than that. Drinking lots of water won't make you slim, it doesn't make you younger, and it doesn't flush out your system and make you completely gorgeous, I'm afraid. It's a bit of a myth. The other thing that some people find, I don't know if any of you eat asparagus, but you know how quickly if you eat asparagus your urine smells strange. Well, that's because you've got chemicals from the asparagus coming through your body and passing through, so it stands to reason that there might be other foods that you eat that might make things worse. So just have a little think, oh yeah, when I had that, this happened. Some of those things might help you. The other thing we like to do is just to get you to keep a little diary. It's very interesting. If we find a normal bladder will hold about 350, 400 mils quite comfortably, but if you find that just pee into a little measuring jug, it's fine, your urine is sterile. And if you think, oh my goodness, I'm doing 50 or 100 mils a time and I'm going 15 times a day, that's not normal. Normal would be passing urine 4 to 6 times a day and passing a volume about 350 mils. You're allowed to get up about once a night, but much more than that isn't normal either. There are some medications available, but before the medications we really like you to try some physiotherapy, and again on our website there's a little leaflet on bladder training. Have a look at that. Perhaps go to your family doctor and ask to get referred to a physiotherapist who can help you with some really neat tricks to hold back that urge to go, and they can also help by really pepping up those pelvic floor muscles to make sure you've got every chance you can to help your bladder symptoms before you need to go on to any treatment. Some of the treatments that commonly used oxybutynin, that's a little, some of you may have it, it's a little blue tablet and you can take it usually about twice a day. It can make your mouth quite dry, which is why we don't just give it straight off. And there's some more modern ones such as Vesicare and some patches. This is just a once a day one, and this is a replace at intermittent intervals. And at these meetings we go to, we see all the new innovations, and as we speak there's more drugs coming through the system that are looking hopeful now as well. If all that fails, Botox are not just for wrinkles and making you younger. They can actually be really, really helpful if you've tried the physio, you've tried all the lifestyle changes, you've tried medication, and you're still finding that you've got urinary urgency. We can do intermittent injections into the bladder just to calm it down and relax that bladder muscle. And then sort of the last resort is more a much more expensive treatment. This is like a little pacemaker that stimulates a little electrode down here that helps to control the bladder function. And as I say, this is our website. If that all looks too long, just Google IUGA, I-U-G-A, and that will take you through to our website. Go into the patient information section, and we've got a whole lot of leaflets, not just on urinary incontinence, but on prolapse, on constipation, which is another common problem that we find. And those are freely available for you to print off and download. And we're very happy for you to do that. Thank you very much.